Pure red cell aplasia, or PRCA for short, is a rare bone marrow disorder characterized by the severe decline or absence of erythrocytes produced, and as a result, it causes an absence of erythroid precursors. Now, due to such declines, patients affected experience anemic effects such as fatigue, dizziness, lethargy, and abnormal pallor.
The incidence and prevalence of this disorder is not subjected by race, geographical location, age, or gender, although this has been found to be genetic in some types of PRCA. There are many classifications defined by, say, which range affected, whether it is congenital, primary, secondary, or acute.
So the causes of PRCA can be idiopathic, itself as a primary autoimmune disorder triggered by viral infections or other immune disorders or drugs. It could also be triggered by a tumor present in the thyroid gland.
So Steph here is a 7-month-old infant who has just been admitted to the hospital for abnormal pallor, rapid breathing, and a rapid heart rate. Her parents have reported constant irritability or crying in waking hours and alternate hours of drowsiness and extended sleepiness prior to admission. Her family history indicates type 1 diabetes as a possible source, otherwise none other diseases. As an infant, she had previously been given blood transfusions, as her medical history had indicated anemia at birth, as well as a lower than normal birth weight and microcephalopathy. Through her history and symptoms provided, indications of type 1 diabetes and Pearson syndrome could be assumed.
So a complete blood count was carried through, and from the table here we can see abnormal drops in red blood cells, hematocrit, HemCH, and MCHC. Now reticulocytopenia was also detected. Now the red cell distribution width and MCV was also shown to be high, followed by a normal white blood cell and platelet count. Following this, a white blood cell differential and blood film were performed, and here white blood cells showed remarkable results that were completely normal. However, a severe lack of red cells could be seen.
Further tests were performed, and these are shown. A direct Coombs test for indication of antibodies that attack red blood cells, and serological tests all showed normal results except for elevation of erythropoietin. DNA testing for parvovirus B19 and other genetic studies were also done, wherein this indicated negative B19 results. However, it did indicate an abnormality in the ribosomal protein S19.
Now, after consultation with a doctor and hematologist, a bone marrow aspiration was carried out. It was found that there was a severe lack of erythroid precursor cells. However, white blood cells and platelets were completely normal.
Gathering all the results indicated, Steph showed high indications of PRCA, and a final diagnosis of Diamond-Blackfan anemia, or DBA, was made. DBA is a congenital form of PRCA found in newborns to 2-month-old infants.
Now, Steph is currently being treated with packed blood transfusions, which are scheduled for 3 per month for 2.5 years, and then 1 a month for another half year. Now, iron chelation is followed to compensate for the amount of iron that's increased in the bloodstream due to the constant blood transfusions. Steph has also been prescribed with tab delta-cortil, a corticosteroid treatment for increased sensitivity to erythropoietin.
As a result of a diagnosis of DBA, constant checkups are needed for as DBA can affect her later years in puberty with irregular menstrual cycles and decreased fertility. She is also prone to developing kidney abnormalities as well as structural defects of the heart. DBA has also been known to increase risk of leukemia, sarcoma, and hematopoietic malignancies.
So, in summary, PRCA is a normocytic and normochromic type of anemia, but in infants, this is usually present as macrocytic red cells. This is characterized as a maturation arrest in only erythropoiesis, where the precursor cells of erythrocytes are being destroyed as an autoimmune effect, and this can severely affect the amount of red blood cells present in peripheral blood.